Joining us today for our webinar, Sleep Up for Schools. We'll begin in 2 minutes. Good afternoon and welcome. I am Noelle Ellerson-Ing with AASA, the School Superintendents Association, and on behalf of AASA and our sister associations leading the nation's public schools, the National School Boards Association, the National Association of Elementary School Principals, and the National Association of Secondary School Principals, we're pleased today to be joined by two experts from the CDC in a discussion related to the critical program, Sleep Up for Schools, the school and childcare staff COVID-19 vaccination program. As a reminder, a recording of today's webinar with any and all related links or content that appear in the chat will be emailed to all registrants, not just those who dial in, so that information will be available. As we go through the webinar, if you have a question that you would like to pose to our experts, please drop that in the chat. We'll be monitoring the chat box and we'll pose those questions to the experts at the conclusion of their prepared remarks. So thank you again for joining us today. It's our honor to be hosting Dr. Kathleen Ethier and Dr. Aaliyah Samuel from the CDC. Please allow me a brief introduction. Dr. Samuel is Deputy Assistant Secretary for State and Local Engagement at the U.S. Department of Education and is a former Senior Fellow at the Center on the Developing Child at Harvard University and Executive Vice President of Government Affairs and Partnerships at NWEA. Aaliyah is a bilingual executive leader with expertise from early childhood throughout higher education. Her experience includes program evaluation and evidence-based programs, data collection and disaggregation, family and community engagement support strategies, and policy development and implementation at the local, state, and national level. She has informed state policy agendas, assisted with developing cross-systems approaches to develop policy solutions to support children and families, and leading systems level change. In her role at NWEA, she led a team working on driving a state and federal education agenda. Prior to NWEA, Dr. Samuel was the Director of Education at the National Governors Association, where her work included business development, strategic planning, and supporting high-ranking state officials on the development of policies that impacted health, education, and workforce. Aaliyah has worked with diverse constituents, philanthropies, and national partners. She holds an undergraduate degree from Tuskegee University, a master's from University of South Florida, and a specialist and doctorate degree from Nova Southeastern. Our other esteemed presenter today is Dr. Kathleen Ethier. She's the director of CDC's Division of Adolescent and School Health. She's currently serving as CDC's COVID-19 response as the lead for the school staff vaccination program. Prior to her appointment as director of DASH, she served in a variety of capacities across CDC. Her work in these positions has focused on developing strategic direction for agency priorities, best practices for using data and decision-making, and improving program evaluation. Prior to her work at CDC, she spent 6 years on the research faculty at Yale University studying HIV, STDs, and unplanned pregnancy prevention among women and adolescents. Her research has included psychosocial, behavioral, organizational, and clinical factors related to women's health, maternal health, and adolescent sexual and reproductive health. Dr. Ethier earned her PhD in social psychology from the Graduate Center of the City University of New York. It is my privilege to host you today, and I'd like to turn it over to you, Dr. Samuel and Dr. Ethier, for our content and conversation.
Thank you so much, Noelle, and I apologize to everyone. I am having Zoom issues. You'd think a year into the pandemic, Zoom would be mastered, but for some reason it is not loading today on my computer. So good afternoon, everyone. Thank you so much for joining us. I think out of everything that's in my bio, the one biggest omission that I forgot to put in that I absolutely should have is that I am a former elementary teacher, assistant principal, and principal. I was actually an administrator in 2 different states, and so I'm a proud public school educator. And this conversation is actually very near and dear to my heart, both as a former educator, but also as a parent of 2 young sons in public school and elementary school. And Kathleen and I really wanted to have an opportunity to have just a really transparent, honest conversation regarding how we can better support district leaders in supporting teachers and ensuring that they take full advantage of the school personnel vaccination program. And so with that, I'm actually going to turn it over to Kathleen to give really a high-level overview of the program, and then we'll start jumping into some of kind of the larger themes and questions that we have been hearing from the field since President Biden really began this initiative early March. So with that, I'll turn it over to Kathleen.
Great, thank you so much, and so happy to be with you today to talk about just what is, I think, a really essential component to helping our schools be safe. So where we started was back on March 2nd, President Biden announced a directive that all 50 states should open up their eligibility to teachers, school staff, and childcare workers for COVID vaccination. And then he also directed us to open the federal retail pharmacy program to prioritize teachers, school staff, and childcare workers for the month of March. So part of why we are here with you today is because as we head toward the end of the month, we want to make sure that you have all of the information that you can about this program because you are such an essential component to your staff, both your teachers and your school staff, accessing vaccinations while they are prioritized in the federal retail pharmacy program this month. When we started, 30 states, Washington, D.C., and Puerto Rico, all had some form of eligibility for school and childcare staff prior to the directive. National Education Association data collected right just prior to the directive indicated that about 49% of teachers had already been vaccinated. But we know from other data that that's much lower among the broader school staff. But as a result so far of this effort, 15 states have expanded their eligibility following the directive. And now all but 5 states have fully expanded their eligibility to include teachers, school staff, and childcare workers. And those other 5 have some eligibility for some of those groups, just not complete eligibility. But we have expanded the federal retail pharmacy program to include prioritization for appointments across all of those states and DC and Puerto Rico. And so we have been really able to broaden the reach. And that includes at this point over 10,000 pharmacy locations across the country. That program is designed to be accessible. And so 80% of the population of the United States lives within 15 minutes of one of those locations. But also, I think expanding the rest of the states to include their state programs really allows for a variety of options for people to get vaccinated. We've developed at CDC a set of communication materials, including a toolkit for local jurisdictions, for local school districts to be able to get information out to their school staff, to tell them where to go to access vaccination, why they should want to be vaccinated, and a whole host of communication tools that you and the principals in your local districts can use to encourage vaccination. We feel a certain sense of urgency at this point. It's March 22nd. We really want to get the word out to as many local districts as we possibly can. And so knowing that you all are those people, to really get the word out to as many people as possible who are ready to be vaccinated. Another really important piece of this effort is not just to get folks who are ready to be vaccinated to the right places. That's a hugely important part of it, but also to build vaccine confidence among staff who might not be ready. And some of the data that we've seen has indicated that while teachers, a higher proportion of teachers and of educators may be ready to be vaccinated, school staff more generally, so those non-classroom school staff may be more hesitant. And so for us, because equity is such an important part of what we are doing, and I think it was a really incredibly important piece of the directive that this not only focused on teachers, but all school staff, including cafeteria workers and custodial workers and bus drivers, that we want to make sure that the distribution and access to vaccines is really equitably provided. And so then we also know that there's work around vaccine hesitancy and building vaccine confidence that really needs to happen. So we have a whole set of materials included here that will help have those conversations so that you can talk to the folks in your district to really get the word out, build trust, build confidence around vaccination. So I'm going to stop there. I know that's a lot of information that I just threw out at you about the real purposes of the program and why we wanted to talk to you today. But happy to answer whatever questions anyone might have. And I think Aaliyah and I are going to start for a few that we knew you probably would have to talk about this some more so that you can feel confident in going back to your districts and really talking about these efforts.
Thanks, Kathleen. So the first question I want to throw out to you it is around what can school administrators do to help build that vaccine confidence that you mentioned as you were just referring to the program?
So the two most effective things that we've been able to find are really building trust. And trust comes through both having people with expertise speaking transparently, clearly, and accurately about the safety and efficacy of vaccines, of this set of vaccines, and why it's so important. So why, what the vaccines will do for their staff. The other is to have people who are peers. So as more people in a school district get vaccinated, having them speak out, and particularly on social media or in among their peers in meetings about why they chose to get vaccinated. That's partially why we chose a hashtag, Sleeve Up for Schools, that I think speaks both to the issue of immunization, but also why we're doing this. We're doing this for our schools, and we're doing this for the other staff in our schools, and we're doing this for the kids in our schools. And so really taking those messages back and finding both those trusted experts and those trusted peers, I think are the two keys. We have every, I think, piece of information that you could possibly want on our website, both in terms of kind of the scientific background and information, but also messages that can easily be used. So feel free to take our social media, feel free to take example emails from our toolkit and use those in your districts, because I think we've built them around both to be accessible and to be effective.
Thank you, Kathleen. So you just mentioned the wealth of resources. Another question we've been asked a lot about is the actual locations for administration of the vaccinations. And one question that we're getting is, will there be an opportunity to have site-based vaccinations at actual school sites or hubs within the districts to make it easier for teachers to have kind of a one-stop shop?
We have heard from a lot of districts across the country that have done exactly that. And they've done it in one of two ways. One is to work with your local health department. And within that kind of approach, two things have worked really well. One is to, actually, as you mentioned, set up a vaccination clinic in a district, in a place specifically for teachers using a school. We all know schools get used for a lot of different events and activities. They're the real center of a community. And so it's not difficult to set something like that up. The other is when a community is having mass vaccination events, is to set aside specific times for school staff. And both of those things have worked really well. I think the key is to have kind of a single place, a designated time, and to then blanket, get the word out about about that single place and that single time. So it could be less important where it actually is, and most important that it's a designated time. We've also seen where pharmacies that are participating in the federal retail pharmacy program have also done mobile clinics and can come to a school or can come to a school district and do vaccination events. That requires contacting the pharmacy program in your local jurisdiction, and you should be able to find that on your state's website. So those are the two ways that I would suggest setting up specific events for staff, I think, that have worked really well that we've seen across the country.
Thanks, Kathleen. And one more question that we have been getting pretty consistently, if you could provide some feedback, is what about those educators or school personnel that really want one vaccine or another because of concerns? Could you talk a little bit about the vaccine safety, and how would you have administrators respond to those school personnel staff that say, oh, well, I'm not sure about this vaccine versus the other?
I think first to go onto our website and look at what's available about the various vaccines. The Pfizer vaccine and the Moderna vaccine are almost identical. And so I think, whichever, honestly, of the three, whichever you can get, you should take. At the same time, people have felt they wanted the J&J vaccine because it's one and done, it's one shot. I think that at this point, given supply issues, the most important thing is to get vaccinated. And if you can talk to your staff in those terms, I think that is going to be the approach that's going to get the most people vaccinated as quickly as possible. There's not enough difference in safety or efficacy that it makes that much of a difference which one you get. You are protected they're at very high rates regardless of which vaccine you get, and all three vaccines are incredibly safe. So I think to message that way and to educate yourselves or have your staff educate themselves about the safety and efficacy of all three. I think at that point, if there is a two shots versus one shot, I don't know that we have enough supply this month to be able to make those distinctions. And so I don't, until we get a really, kind of ongoing supply of J&J, it may not be as easy to make that choice. We certainly don't want people waiting. If you have the ability to get in, especially this month while teachers and school staff are being prioritized in the federal retail pharmacy program for appointments, we want you to get in as quickly as possible.
Thank you so much, Kathleen. So Noelle, I'd like to just turn it over to you, since I don't have access to the chat box, to see if there are any questions that are coming from the chat.
Yeah, there are. I have 3 of them right off the bat. So thank you, Dr. Samuel, and thank you, Dr. Ethier, for kicking this off or framing it off. The first one I want to address is actually a repetition of something we were talking about in advance of the call. Can you walk us through the idea that there's just 10 days left? And what does this mean in terms of, is it 10 days for federal priority? Can states do more? And that's related to one of the first questions. So in addition to that, which 5 states don't still have complete eligibility? What does complete eligibility mean? And when are those states expected to have full eligibility?
Okay, so let me get a little bit more into the details of this. So the directive, the directive that President Biden announced on March 2nd was that he was requesting that all 50 states expand their eligibility to include those 3 groups, and that we would dedicate all already untaken appointments in the federal retail pharmacy program across all of those states for teachers, school staff, and childcare workers. So the prioritization of appointments for those groups in the participating pharmacy partners will be for the month of March. And after the month of March, they will still be eligible in all of the pharmacy partner sites, and especially as those sites expand, as we expect them to, teachers, school staff, and childcare workers will still continue to be eligible. However, we won't be prioritizing them for appointments. We diverted a lot of time and effort and energy for a specific period of time to really prioritize those appointments. We're not going to be able to continue to do that. So, and we're hoping that we will have gotten a really good part of the way toward getting most people at least their first shot. The states that have, there are, as I mentioned, there are 5 states that haven't completely expanded their eligibility. And what that means is that in some cases, like in Florida, they have expanded eligibility to include teachers and school staff and childcare workers, but only those over the age of 50. Similarly, in West Virginia, it's over the age of 40. So they've maintained age requirements to their expanded eligibility. And what we've asked them to do is to take those away. So far, they've left them in place. There are several states, I think, Montana is also a state that is where the age range of who's eligible is limited. North Dakota, the eligibility is limited to certain counties, so it's not statewide. And there's a county by county eligibility for that includes teachers, school staff, and childcare workers, but it's not every county. And in Utah, teachers and school staff are eligible, but childcare workers are not. So just some variations. The question came up of when might the eligibility be expanded for everyone. I can't answer that. I don't know why those particular states have maintained the eligibility restrictions that they have. I mean, I think we're hopeful that as the president announced by May, that we will have enough vaccine for everyone to for all adults to be able to access them, and that's what we're continuing to work toward. But I know, especially as we continue to move toward reopening schools, to have that safety net of having teachers and school staff be vaccinated is of utmost importance. And so we would love to see these additional states also fully expand.
Thank you for that. Moving right along to the next question. Are you seeing areas of confusion or misunderstanding that are preventing school staff from getting the vaccination? And if so, what are those gaps and what can district and school leaders do to help address them?
It's a great question. Thank you so very much for that. I think there's 2 areas, maybe 3 areas of question and concern. I think there are a lot of, I think many people who are educators, many people who work in schools heard that they would be eligible, but don't know much more than that. And I think part of why we wanted to talk to you all today is we've developed all of these materials, all of these tools to help educate people about their eligibility. So who is eligible? Where can they go? How can they get access? And that information really needs to get out. So we have dropped in links to all of this information, all of these tools. We realize that you all are incredibly busy people and probably don't have the time every day to be sending out information to your school staff. But if you could empower someone on your staff to be the communicator about this issue, would be incredibly helpful. So that's one thing, is just educating staff to let them know that they are eligible. I think we have heard from, I think, as I said earlier, I think teachers often know that this is available for them, but I don't think that necessarily the broader school staff understand that they are that they are also eligible. I heard the president say bus drivers, and I was so glad that he said that when he was talking about the program. But we also want everyone who is in a school, interacting with each other, and then potentially interacting with kids, we want you to be vaccinated. So getting that word out and giving them that information. There are a couple of pieces of concern that we heard come up in some data that I want to make sure that everyone knows, and that is that these vaccines are free. So if you access vaccination in a place, they might charge a small administrative fee, but no one should worry that they can't afford this vaccine. And we have heard that expressed particularly more among the broader school staff than among the teachers in some surveys that we've seen. So I just want to make sure to say that as well, that's something that I think your staff really need to know, that if they're concerned that they're not going to be able to afford this, the vaccine is free. I think the other thing is there's issues around safety and effectiveness. So we're going to give you all the tools that you could need to address those issues. And then I think folks want to know what their peers think. So peer conversations, we're doing a whole series of spokespeople videos. So we're doing a lot of social media around this and making sure that we're using people that your school staff will see as peers, because that's incredibly important. So I think getting that conversation going in your district, I think will help allay a lot of those concerns.
And so because you're very good at your job and amazingly thorough, you actually addressed the third question, but it warrants repetition. And it goes down to this definition of teachers, right? So we've seen some people say teachers and mean educators in an all-inclusive manner. So you have this overlap or sometimes disconnect between teachers, educators, and school staff. So just once again, for those in the back, your definition and intent here in terms of eligible group is yes and to all of those.
Everybody.
But yeah, everybody. There's a little bit of confusion that only classroom teachers are eligible. So can you just talk to us a little bit about how you're working with associations like ours and with states to make sure eligibility is clearly communicated, and or what might be able to be done at the site level where these are being administered to help clarify and confirm that yes, you do in fact qualify?
Yeah, there's two things here I think that are important to note here. One is that everything that we have, all of our materials make it clear that we don't ever refer to anything as just a teacher program. We actually, when we named our very small but mighty team that we put together quickly around this directive at CDC, we made sure to call it the School Staff Vaccination Program, because we wanted to make sure that kind of broader definition was really baked in. And I cannot convey enough how important it is to us that be a very clear point. So all of our materials say that. They all also list the whole variety of staff in a school who are eligible, which is basically everybody. So in all of our communication materials, we're very clear about that. Every time I talk about the program, we talk about that. But the other thing I think to be also clear about is there is no requirement that anyone who works in a school provide any kind of documentation when they make an appointment or go to get their vaccine, proving that they work in a school. And we did that partially because we wanted to make it as easy as possible on the federal retail pharmacy program partners to not have to set up any additional kind of screening requirements, but also because we didn't want to put any barriers in anyone's place to feeling like they were going to be questioned in any way as to whether or not they really worked in a school. And we understand that will mean that there will be some people who might try to cut in line, but we felt like it was important enough to make the process as seamless and easy as possible in order to do that. So there may be some states that have some questions that you need to answer, but when you go to one of the retail pharmacy programs and you go to get your vaccine, there's no paperwork required. You do not have to show them your school ID. And we were really deliberative about that.
Okay, so when we reach the end of this formal 10-day period, we won't be near herd immunity for the general population, but we don't even really have a read on where we'll be in terms of critical mass. So, what's the interplay between what the administration and the CDC can do after this push for this month ends, as well as what your efforts are in place to continue to facilitate and push to the extent possible vaccinating educators, particularly as we look at the importance of doing so for the duration of this school year as more and more schools come back online or well, I guess in person is the phrase I should be using, back to in person.
Yeah, I mean, the great thing is that the eligibility will remain, and I think all of the, all of the materials that we've put together our website will stay, all of our social media will continue. We can continue to work on that. Luckily, I will go back to my day job as the director of the Division of Adolescent and School Health at CDC. It is my mission in life and my mission in this pandemic to do everything that I can to help schools be safe and to help schools recover from this pandemic. I think none of us who work anywhere close to education are under. We all recognize kind of what we are currently dealing with and what we're going to be dealing with for a long time. So we will continue to be committed to doing everything that we possibly can to help schools open safely, and to make sure that everyone in the school setting, including both adults and children, are safe. And having adults be vaccinated is a really key part of that. And so we'll continue to work on it and continue to prioritize it in our messaging.
And so I get to try to bridge as much as I can all these jumping and jumping based on the questions that I'm getting. So I'm going to try a little bit of a transition here. But one of the things I've received is, just to be clear, were you saying that after March, states can continue to prioritize educators and just no longer required to, or there's not the cover from the federal government, right? So just because the federal government is unable to extend it or essentially mandate this prioritization, a state can continue, correct?
Yes. So the difference is between prioritization and eligibility. So we were not able to require that states prioritized educators and school staff for their own appointments, their own programs. We could only direct the pharmacy piece of that. So we directed everybody to open their eligibility, and directed the pharmacy program to prioritize educators and school staff for appointments in the retail pharmacy program. Other things that states have done, we've been so excited that they've joined us in this month and have set up special vaccination events, have gone into schools. All of those state efforts have been just amazing and wonderful. And some places have gotten, they've gotten 75% of their educators and their school staff vaccinated. I mean, it's just been amazing. And they started that, many of those places started that process back in January. So they can continue to do that. That's absolutely the case. The only thing that ends at the end of the month, which is an incredibly powerful tool, so we want to use it, is the federal retail pharmacy program prioritization.
Then I think I have a professional responsibility here as an advocate. There's a role here for some of our members to play within their own state to help push for either continued eligibility or prioritization within their state structure, to the extent that it's either, if it's already going, give them the cover to keep doing it. And if it's not happening, use your voice, because if you as a principal or a superintendent and board member are trying to get more of your students back in person, that inoculation is a critical safety protection for the staff and the students.
Absolutely. I think one of the, I don't know, I'm an optimist by nature. So one of the kind of silver linings, I think, has been the understanding of the role of schools in communities, in families, and obviously in children's lives. But nothing works if schools aren't working. We've seen that over the course of the last year, and so I do think that you all have a great ability to say to your states, we want this to work, and to work with your state and local health departments to set up vaccination clinics, or to ask for prioritization in mass vaccination programs for your staff. I think, this will be an important way to get adults comfortable being back in person. And so helping them do that and making everyone safe, I think is what everyone wants. So yes, so I would absolutely talk to your state and local health officials about working toward those events.
Great. I had another question pop up, so I'm going to pose this to you. So you mentioned that prior to the program, just under half of the educators had already been vaccinated. Would that percentage possibly be much lower when taking into consideration broader school staff? Do you know the updated percentage of school staff that have been vaccinated so far? And where can we find this information at the end of the month for comparison?
All right, so you're all playing right into my hands with that question. So one of my additional asks of you is, there is very little really good data on really widespread data on what proportion of all of the different people who work in schools, the proportion who have been vaccinated. If they haven't, why? So we have put together a 15-item survey. It's been approved by our IRB. It has been approved. It's gotten OMB, PRA approval. If you know what that is, you would be cheering for us. And it is ready to go. And so one of the asks that I wanted to make of you all today is to let me send out through your partner organizations, through AASA and through the other groups who are with us today, this survey that you can blanket your staff. It'll take them 5 minutes to do. It's the Survey Monkey. And that will tell us, I think, will give us a lot more information about what proportion of various categories of school staff have been vaccinated, as well as issues around any hesitancy they're having, so that we can kind of do a last push toward addressing those issues. So I'm going to ask if it will be possible to send that survey to ASA and to the other organizations, and if you would be willing to send it out to your members and have them send it out to their staff, that will give us a lot more information. We have some other smaller surveys, some polling data. We're hoping that NEA reruns their survey again, but none of these are kind of widespread and don't give us all of the different segments of the school population. I will also say that we get data back from the pharmacy partners, which is only the pharmacy partners. As of the first 10 days of the program, so from March 3rd to the 13th, the pharmacy partners had vaccinated more than 760,000 teachers, school staff, and childcare workers. They lump them together, so we don't know. And we're due to get another, I think we'll be well over 1 million when we get the next report, which is, I think, at the end of the day today. So I think people are accessing the program, but I think that there's still so much more to do.
And so, to acknowledge the question that you asked, I'm sure we can find a way to get that survey out to our members. Survey fatigue, I mean, I have to do my job here. Survey fatigue is very real for our members right now, but this is important work. So we'll work with our communications team, which includes Julie, who is the woman behind making today's webinar happen, to see what version of that information we can get out to our members.
Sorry to put you on the spot in front of everybody, but you asked the question, so.
Right, I'm an advocate. I have to ask all the questions, and you're just doing your job. We're happy to be able to partner here and happy to be able to not only raise awareness about the effort on the important work of vaccine educator, but we at AASA, and I know my colleagues at with the elementary school principals, the secondary school principals, and the school boards are grateful not only for the opportunity to make this information available to the principals, superintendents, and school boards doing this work, but as part of the broader effort, we've done a couple of webinars with both CDC and the Department of Ed, and I know that we all look forward to this continued collaboration. So I haven't received any additional questions in the chat, so I'm heading towards closing us down. We have about 15 minutes of return time that we can give back to both Dr. Samuel and Dr. Ethier, as well as our members who were able to join us today. So thank you again, Dr. Ethier and Dr. Samuel. I'm Noelle Ellerson-Ing with AASA. It's been a privilege to host you. It's been an honor to know that our members joined us today in the middle of everything they have going on. Always appreciative of the work that we can do with our sister organizations, NAESP, NASSP, and NSBA. And again, today's webinar has been recorded. We will email this and all the related links that were dropped in the chat out to all registrants. Thank you for joining us today. Enjoy the rest of your day and stay healthy.
Thank you. Bye-bye.
Thank you.